Hi guys, Dr. G here. I decided to make this little video because I wanted to reach out to as many people as I can to talk to you a little bit about how this, COVID-19 situation has sort of affected us, our profession, our practice, our staff, our patients. I think it's really important to sort of share what's been going on. As most of you probably already know, the COVID-19 situation, we've been mandated to essentially limit our practice, either completely close or limit our practice to only urgent or emergency procedures, meaning we would have to stop doing anything elective, routine, anything that's non-urgent, and strictly focus on emergencies. And as a result, essentially in our area and most of the country, most dentists completely closed their doors, and that was just a personal decision that each and every dentist and their staff had to make to sort of minimize the risk to themselves, their patients, their families, and all that stuff. So it was a tough decision for us as well. Ultimately, we wanted to look at it like, how do we get to be a part of the solution, and our part being, keeping the certain patients out of ER and urgent care waiting rooms that were coming in for dental emergencies, which we knew was going to happen. So we decided to just see dental emergencies and make ourselves available for those folks. And as a result, the result of that sort of shocked us, and completely blew us away. And that's what I wanted to share with everyone, because as a result of that, over the past 2 months, we saw an incredible amount of dental emergencies. It was a lot. The demand was so high, we could barely keep up with the phone calls. The scheduling was very difficult. Not to mention the strange world that we live in right now, and the PPEs and everything. We had to do what we had to do to make things work for everyone. However, the saddest, the most scary, the most, I would say, frustrating actually part about it all was the fact that most dental emergencies are completely preventable. I would say 99% of them are completely preventable if you treat it on time, early, get to it before it flares up and gets to the emergency state. Totally doable, maintainable, easy to do. It's just a matter of making sure you're on top of it. So, in every story, every case, every patient that came in had their own story of how it all happened, how they got to this point, and everyone had their own journey, but every story ended with, well, I wish I got this done, X amount of months, years, blank ago. And, or I wish I would have maintained and stayed, on top of going to the dentist, didn't let it go for X amount of years, stuff like that. So that's what I want to kind of talk about, because, we ultimately, dentists and all of our staff, we got into this field really genuinely because we wanted to see good results. We wanted to see happy patients. We wanted to see their smiles. We wanted to see those before and after photos and be proud. We wanted to be a part of someone's life and change of their life for the better, increasing of quality of life of the people that we treat. We did not choose this field because we wanted to sit back and tell every other patient, I told you so. That's a very uncomfortable conversation for us, for the patients. It's kind of just like this big elephant in the room. Everybody knows it. No one's really talking about it because it's weird and uncomfortable. So I'm happy to say that we didn't see that many of our own patients. I can probably count on one hand. We mostly saw other patients who perhaps, haven't been under the care of a dentist for a while. We do spend a lot of time with our own patients just kind of talking about the importance of treatment and treatment early, sooner rather than later. We really spend a significant amount of time. This is why. But again, there's a lot of folks who are not under the care of a dentist for various reasons, and so I figured I'd put this video out there for everyone and hope that this really kind of sinks in for people and helps them understand and how can we avoid dental emergencies altogether, because they typically occur in the most inopportune times. That's just what happens. We know this. Like a time of a global pandemic or something like this. So essentially what we've come down to is two most important things that I think if we all do this, we'll all be all right in terms of our dental health, our oral health, which is crucial for the rest of our health. Number one, go to the dentist. Go to the dentist every 6 months. It's just that simple. I know it seems intuitive and silly, and it's nothing I came up with, but it's just that simple, and a lot of people still don't. Go to the dentist every 6 months or more frequently, depending on your maintenance schedule. It's worth it. It's maybe 2 hours in a year that you spend in a dental chair, but it's worth every minute of it. And take those x-rays. Those x-rays are crucial. That's why we take them. We typically take them every 12 months. Some patients more frequently, some patients less, but on average, that's how it works. And I would take them because that's a crucial diagnostic tool that we need to be able to catch disease very early as humanly possible. So that's number one. Do that. Number two, when you are given a treatment recommendation, follow up with it. Get it done as quickly as humanly possible. Get it done that same day. Get it done the next day, that same week. The quicker, the better. Every time. Every time. There's no exceptions. This is the way to avoid dental disease, the progression of it. It never just gets better by itself. It doesn't go away. And it, again, seems so intuitive and obvious. However, a lot of patients are stuck on the fact that, well, I don't feel anything and it doesn't hurt and doesn't bother me. I don't see it. Well, my suggestion and the rule of thumb, and every dentist is going to agree with me on this one, is if it doesn't bother you, that's the time to get it done. Because when it does bother you, it's exponentially too late. It's when your body's already mad at you for neglecting it, for letting it go. That's the way to think of it, at least. There should really not be any symptoms associated with hard tissue in your mouth. So get it done early, get it over with, peel it off like a Band-Aid, and you should be fine. That's my 2 cents, and I think that if we can all stick to that once all of this is over and stabilized and things get back to some form of normal, stick to those visits, be on top of them for yourself, your family, your kids, your husbands, wives, parents, whoever you can get to make sure that they're not neglecting this. Then we'll all be in a much better situation. I think now we're starting to really realize how important health is and how important health care is, and that availability and making sure that it's predictable and routine and staying on top of things. So that's all I have to say. I hope everyone is staying home, staying safe, staying healthy. I really can't wait to see everyone in the office. And if you guys still have any emergencies, we're still available for you. So just give our office a call. We love you. Take care. We'll get through this together. Bye.